Hello, this is Danny Blyth looking at sleep in traditional Chinese medicine, adults and children. Remember, this is for acupuncturists, students and practitioners only. Please pause and read this. So we said in adults, insomnia is caused by heat disturbing the shen not rooted because of deficiency or shock, the shen obstructed by a stagnation, or the shen disturbed by something else. In babies and toddlers, we see heat disturbing the shen, hun or zhi. We see deficiency either of blood not rooting the shen or shock. The stagnation is usually qi stagnation or cranial compression. And the other thing that's very common is cold stagnation leading to pain. So heat disturbing, if it's the shen, there's difficulty getting off, restless sleep, staying awake for a long time. If the zhi is affected, fearful of the dark or of monsters, wakes early, wide awake. If the hun's affected, dreams, sleepwalking, sleep talking. Also with heat, we see a child that's hot, thirsty, red cheeks, unsettled, restless. There might be tantrums, rages, or they might be clingy. They often wake happy and then cry either for attention or because they're fearful. And heat is common during teething, during a lingering virus or during a growth spurt. And this can come from womb heat, accumulation of food, post-infection reaction, or from emotional distress. With blood deficiency leading to shen and hun not rooted, what we see is frequent waking, but easily off in the evening and easily back off to sleep again, and often off with contact or with food. Tongue's often pale, as is the face. If the spleen qi shu, we get a pale, tired baby, poor appetite, loose stools and feeble. And we see this as a constitutional issue, as a feeding issue, or from lack of nurturing. So what do we mean by poor appetite? In babies, this means not sucking or attaching well, late to wean, no interest in food when they should be weaning. In toddlers and older children, eating small amounts, having a limited range, having a poor appetite and being a picky eater. In terms of low energy, in babies what we see is a limp, somewhat floppy, lethargic child that sleeps a lot and doesn't make a lot of fuss. And in toddlers we see children that are lacking oomph, slow to grow, easy to ignore, somewhat introverted, a weak presence, easily tired and frail. If shock disturbs the shen and the zhi, what we see is waking suddenly, being fearful, nightmares or night terrors, cries out in their sleep and then hard to settle down again. Generally they might be anxious, restless, easily upset. There might be a blue tinge on their face, especially the bridge of the nose, and they might have a choppy pulse. And this shock can be in utero, it can be during the birth or early on in life. What we see with qi stagnation is dull headaches. They don't tell you that. They may well have a tender head, so hair cutting, washing, brushing can be difficult. You might see dark areas of stagnation on the scalp as shadows, or you might see distended blood vessels. There might be difficulty falling off because the intracranial pressure rises as we go off to sleep, and this is where they get the headache. They might like banging their heads or being very rigorously rocked or jiggled to move the qi. And this can come from a birth which is difficult, long or quick, or from a knock to the head. Finally, for little ones, cold stagnation leading to colics. They wake tight and contracted, they pull their legs up, they clench their fists, they might be sweating, they prefer to sleep on their tummy to try and help the stagnation. That's a very full presentation. If there's underlying deficiency, you might get signs of spleen qi deficiency, pallor, poor appetite, loose stools. You see this in children that are cold, either from cold food or cold medication, or have underlying spleen qi deficiency. And another cause is habitual insomnia. So in this case, the child just likes waking up and having a bit of attention. There's not actually a problem, just boundary issues that need addressing and need our support. So some pointers: parents need to be in agreement about the need for change and the strategy for changing. It's a good idea to put children to bed when they're sleepy but not yet asleep, so they learn to be independent sleepers. Waking shouldn't be necessary or rewarding, so if they need changing or they need food, then they're not ready to sleep through the night. And it's not a good idea to, if they do wake up, make it a useful time by giving them food or comfort if they don't need it. It's a good idea to make contact, but don't stick around, don't turn the lights on, don't give them too much fuss, wake them up. And finally, it's really important to reassure your parents that the children will still like them in the morning, and that because they're not being tended to, if they're crying, they're not going to forever hate their parents. What we see in older children and teenagers is often heat and fire in the liver and heart, liver-qi stagnation, again heart, blood and yin deficiency with the shen not rooted, and especially kidney yin deficiency with empty heat disturbing the shen. So with heat or fire in the liver and heart, we get light sleep, frequent waking anxious, restless, hot, and they might be awake for a long time. They might also be irritable, angry, depressed, moody, prone to anxiety, prone to panic attacks, prone to slight mania, and the pulse might be overflowing and rapid. So typical liver qi stagnation leading to heat. This often comes from constrained emotions, being hemmed in, pressure or stress, and from drugs or alcohol. With liver qi stagnation leading to heat, what you often see is either waking at 1 to 3 a.m. or with teenagers, they're often not really sleepy by that point, so they just find it very difficult to get off if they go to sleep too late. And they're awake feeling frustrated or angry very often. They may have busy minds with lots of plans and imagination. They might dream a lot. This might come again from emotional constraint, lack of control, especially children that are overscheduled and not allowed enough freedom of mind. This might be puberty kicking in, might be a lack of exercises involved, there might be some dietary factors, and might be alcohol and drugs involved. With heart, blood and yin deficiency, with an unrooted shen, might be difficulty getting off with lots of circular thoughts, anxiety, and the anxiety is worse when tired, and sleep might be light. On top of that, they might be tearful and emotional, easily startled, poor concentration, and the pulse thin and choppy. So this is what we saw in adults with spleen qi heart blood deficiency leading towards yin deficiency. This might be caused by a shock, it might be caused by an excessive screen time or overstimulation, and it might be rooted in an emotional or relationship problem. With kidney yin deficiency and empty heat disturbing the shen, the child finds it difficult to unwind and hard to get to bed in the evening. They want to be up. They wake early ready to go, are slightly overstimulated, but can be overtired, and that makes the insomnia worse. So the tireder they get, the more they want to stay up. Easily overstimulated, they might be fearful. They're often high achievers. Pulse can be floating and empty. And this can come from overstimulation. That could be screens, it could be too many activities, it could be too tighter schedule. They might be very driven. There might be some fear around, and just a general lack of rest and overstimulation. So that's the most common syndromes for insomnia seen with babies, young children and teenagers.